Yeah, so I've been asked and sort of that we had to put in place to manage our blood stocks. I think there's no guidance out there, so all this is just sort of almost like our opinion and our just what we did. There's nothing in here that's necessarily right or wrong. It's just what we did to try and manage our stocks best during this sort of uncertain time. Can I have the next slide, please? So this just gives you Brighton and Sussex is made up of two main hospitals. Royal Sussex at Brighton, which is level 1 trauma centre with neurosurgery and sort of covers all major disciplines. And then we have another site at Princess Royal, which is a slightly smaller site, has non-trauma A&E, does have some surgery, and from PRH we also provide blood to Queen Victoria Hospital, which is about sort of 45 minutes away, and this is a plastics and burns unit, so there's still a provision required for that site. So that just gives you an idea of our sort of contrasting sort of hospitals on within the same trust. Can I have the next slide, please? So what did we do next when we were kind of faced with obviously a changing sort of scene for us, not a lot of guidance of what was going to happen? So we had an urgent meeting with our PBM. So we got together a haematology consultant and then a couple of consultants from our main users. And within this meeting, we obviously had to draw up a COVID sort of action plan, and we based this on the NHSBT green, amber and red phase, so that we could use a guidance there to then sort of say what we would do within our trust. And this was sort of how we would prioritise surgeries, intensive cares, haemoncology, and we've got a big renal unit, and obviously still accommodating our trauma, GI bleeds, vasculars, aneurysms, etc., that would all still be coming into our hospital. So obviously COVID meant that all sort of routine surgery was cancelled, and that we would just have to manage our sort of urgent cases that were coming in. Our COVID population themselves wouldn't need lots of transfusing, so that kind of didn't have a big burden on us. So we did have to look at amending our stock levels. I can't actually see my slide presentation currently. Can you all still see it?
It's just gone off the slide.
Yeah.
Jackie, do you want to retry, or do you want me to try and share? Okay, just bear with me a second. I'll try and get it out.
So obviously we had to look at amending our blood stock levels during this time, but we also kind of had to be a bit thoughtful, really, because being on the south coast at Brighton, Tooting's kind of 3.5 to 4 hours away for our routine kind of stock delivery, and kind of 2 hours away for a blue light. So kind of we had to be a bit thoughtful about how we changed our stock levels on both sites. If we could go, I think probably 2 slides on, there's one with stock levels on.
Okay, can
cool,
you see
perfect.
that?
Yeah, that's brilliant, thank you. So here, just sort of our normal stock levels at Princess Royal were 98 units, and we reduced that to 60. Our big worry at Princess Royal is they still have obstetrics. So we kept that level there, and at Brighton we normally hold 250 on average, and we reduced that to 160. In order to sort of support this across site, we sort of had to have really good communication between the two sites, and we did sort of good stock sharing across this during this time. If we move on to the next slide, please. So our volunteer driver provision, they upped that instead of just being an overnight service, they basically gave us a 24/7 cover with their volunteer drivers. And this gave us sort of an extra bit of security really about sharing our blood cross sites, which enabled us to sometimes drop our levels down a little for our stocks. We obviously had conversations with our surgical team about maximising their cell salvage. We have a number of ROTEMs in the trust, and we have 2 in our transfusion department that we're able to use to sort of ensure that all our other blood products were sort of selected appropriately. And we tried to we discussed with our A&E colleagues about not sort of ordering generic packs, but trying to use ROTEM guided blood provision. And obviously we changed our BMS hours and our working patterns to protect our staff as well. So we basically had 2 separate teams that basically they never really met. And in this way, they worked longer days, but they worked fewer days in the week. And as I say, we had 2 separate teams. The idea was that was try and protect them, but also to protect our service. So hopefully if one team went down, we would still have another team that wasn't sort of affected by COVID and they could still work. Can I have the next slide, please? Amongst all of this, I think probably one of the key things that certainly has developed across our trust and within our team is obviously our communication, because this has had to be sort of fundamental to how we've managed this. So daily meetings across the trust and linked in with the management meetings, that meant sort of feeding into those trust meetings on a daily basis. So we were using our COVID plan that we'd set up with our PBM and reporting in every day about whether we were in a green state, an amber state or a red state, and just reporting on our blood stocks each day so that they were aware of where we were sitting with each site. Key clinical contacts was also really important. Was on a daily basis we would have an update of who was available in A&E, who was available in ITU, and who was available in obstetrics. They were the 3 key areas that we'd identified, and these people would really give us a heads up on everything. And that was really important with A&E because we're like a vascular referral centre for our area. So if an aneurysm was coming to us from Chichester, we would basically get the phone call whilst they were sort of still in Chichester and on their way, and that would give us an hour basically to review our stocks, relocate stock if we needed to, or order more stock. So it was, and we could do the same with our code reds. You know, it was all about early notification so that we could keep on top of things, and that worked really well with our clinical contacts. As I mentioned before, we had designated teams in the labs that were separate to try and protect our resources, and by splitting the teams it then meant we needed to have kind of teams meetings with our transfusion teams twice a week to make sure that those 2 teams were aware, and that as managing those 2 teams everybody was aware of what was going on, because obviously the way we'd set things up obviously could lead to a big trough in communication. And yeah, it's really promoted sort of good daily communication with all our staff across the board, and across our teams. Can I have the next slide, please? So reviews, well, they're ongoing. I mean, currently we are pretty much back to normal for our activity, but obviously we don't know if things are going to change again and whether we need to review these plans. And I think it certainly made us think about things differently, about how we manage some things. Some of our stock management's changed because it's highlighted some areas that actually can work moving forwards. So yeah, I think we will keep reviewing what we're doing and hopefully sort of make it better for the future. And that's it from me. Thank you.